My name is Robert Kolbe. I'm a medical doctor in Bremen. I have done family practice since 1985. In 1992, I became board certified in geriatrics and have done that also. About a third of my practice is Medicare and geriatrics currently. We all start to forget things after the age of 65, and we can lose about 15% of our intellect by 85, which is normal. We call that benign forgetfulness of aging, and that's where you forget where you put your keys, or you might go to the grocery store and forget to buy milk, but usually you can remember what you had for supper the night before. It gets more worrisome when people start asking questions over again, or they put the milk in the cupboard and the cornflakes in the refrigerator, or they may look at a pen or a key and ask, what do I do with this? So that's more worrisome. If you have a concern about your memory, it's kind of scary. So I think at that point you should seek care. Most of the patients who come in and tell me they're becoming forgetful don't really have dementia. The ones who we worry about the most is when a son or daughter bring in their dad and tell me that they're becoming more forgetful and losing their way and can't use the telephone or can't do the activities of daily living like they used to. So that's more worrisome. They should seek care for that right away. The lifestyle things really prevent vascular dementia, which is ischemic brain disease or lack of blood flow to the brain. Sometimes they're mini strokes, they're called, but those patients usually are obese, have hypertension, diabetes, or other vascular disease. They're the ones that should be on a prudent diet, which is low in animal fats, low in salt, and then try to exercise some sort 30 minutes 5 times a week and try to do ideal body weight. If they cut out 300 calories a day, they'll lose about a pound a week, and that's helpful. Dementia treatment with medication has been rather unsuccessful. Some of the prescription medication can slow the progress, but they're not really a cure. Behaviors become a big issue later in the disease, and we start to use drugs that are typically labeled as antipsychotics, but the behaviors are so bad that they require those type drugs. And food probably doesn't help that much, other than avoiding the fats and salts. The supplements over the counter, they have a little bit of truth to them, but they don't really help delay the progression. Alzheimer's dementia is a slowly progressive loss of intellect, and so it's basically a downhill course. And once the patient reaches the stage where they can't toilet, bathe, clothe, or do activities of daily living, that's when they're going to need help. And they probably need more than help can be provided at home, and they end up in senior care centers or living arrangements where there's observation 24 hours a day. At home, it's hard to do a 36-hour day, which is a great book to read if you have a patient or family member with dementia. I always tell people that in a nursing home or senior care center, there's usually help. They work 8 hours and they're off 16 hours, and you can't do that when you have somebody at home. You want to make sure they're safe. If they're living with you, make sure there's no rugs or cords on the floor that they can trip on. Make sure the rooms are well lit, and turn the lights off at night so they know when night and day is. In the morning, if you can tell them what day it is, the day of the week, or have a big calendar on the wall, or have them watch the news and have them involved and kind of discuss with them, what's going to happen today, what happened yesterday, and kind of ignore because they'll repeat some questions to you, and you can kind of ignore those. They'll probably forget you ever responded to them. To find a provider near you, contact beaconhealthsystem.org.